Good afternoon, everyone, and welcome to today's session. We are in the summer, and the NEET PG preparation typically passes through all seasons. It is an all-season preparation. The rains, the winters, the chilled-out moments, and ultimately comes the summer, reminding us that the days are flying for the upcoming NEET PG exam. So with that preamble, let's make the great beginning, Doctor. Incus is committed to provide the best things for you to support your preparation. We spoke to almost 500 NEET PG toppers in the top 5,000 ranks. We asked them, as the national faculty, we may not be able to match up to the rhythm of the younger NEET PG preparing aspirants. So the best person always to be in your life, to stimulate you and to crack the NEET PG exam, always the best person will be the guy who cracked the NEET PG last before year. And all these postgraduates are very excited. Wow, that's great. Definitely, sir, we love to come and teach. On average, for a national faculty, you end up in paying about 10,000 rupees per hour to deliver a lecture. Whereas these postgraduates, even if you pay even 1,000 rupees per hour also, they're more than happy to help. And they're extraordinary teachers. So on the YouTube channel, every day evening 6 p.m. to 9 p.m., you have various toppers delivering the sessions. And also, you have some of the national faculty also teaching. Both of them are available. So, 6 p.m. to 9 p.m. every day, all 365 days, you have a free YouTube live broadcasted session. Please don't forget to attend. Please click on the bell sign so that you get a reminder whenever the session starts. So, with that preamble, let's make the great beginning, Doctor. Every Sunday, all 52 Sundays, you have a grand test morning, 10 a.m. to 12 a.m. in the morning, 10 to 12. And 12 o'clock, I come down and discuss the question paper with all of you. So this is going to be our journey to crack the NEET PG. In addition to the Incus app on which you are having the 2,000 HD videos, 2,000 PowerPoints, 80,000 multiple choice questions for discussion. Everything on the Incus app. So let's start, Doctor. Now, which is the agent of choice to treat thyrotoxicosis during pregnancy? Keep punching your answers also. Since you already solved the question paper, it's easier for you to punch the answers. It is the propyl thiouracil. A 40-year-old driver had a car accident, severe abdominal pain. There is a minimal retroperitoneal hematoma. So what is the possible diagnosis? So you should remember, pancreas is a part of the retroperitoneum. Any pancreatic injury will lead to the development of retroperitoneal hematoma is what you need to basically remember. Oedipus complex. Always the daughters appreciate the qualities of the father and try to seek them in the person they marry. Similarly, the boys admire the qualities of the mother and try to seek them in the girls that they want to fall in love with. So that is typically called Oedipus complex. So Oedipus and the Sphinx of Gustave Moreau is a very eminent painting in Italy. Now, doctor, sarcoidosis. What is that? Good to see Tina Chowdhury and many more who are all online. Thanks for joining the session. And I also want to tell you, every day evening 6 p.m. to 9 p.m. we have free live YouTube broadcast delivered by national faculty and also the recent NEET PG toppers. NEET PG toppers. Every day 6 to 9 p.m. Every Sunday you have a grand test, 10 to 12, and 12 to 2 you have discussion with Dr. Murali Bharadwaz, all 52 weeks. And this is all Monday to Saturday across 52 weeks. Please inform your friends. So sarcoidosis is mimicked by berylliosis is what you need to remember. The cochlear nuclei, they are special somatic afferents. They bring the information to brain. Afferent. Special somatic afferents. So you should know each of the cranial nerve. What does it contain? Special visceral afferent is olfactory. Somatic afferent is optic. General somatic efferent is oculomotor. Also, it has a general visceral efferent because it leads to pupillary constriction by carrying the parasympathetic innervation. That is the reason general visceral efferent. Trochlear nerve, it has general somatic efferent. Trigeminal has a special visceral efferent because it has a nerve supply to masticatory muscles, swallowing muscles, movements of the soft palate, auditory tube, movements of the tympanic membrane and ear ossicles, etc., etc. So I leave the literature for you, doctor, but definitely this is one sure shot question asked by the examiner frequently. How will ethanol, if you take a beer or a whiskey, you feel like going to washroom? Because ethanol suppresses the antidiuretic hormone and lead to the diuresis is what you need to remember. Now, the common diuretics and how do they act? There is one table. So all these PowerPoints are made available in the Incus Learning app. So please don't forget to download the Incus app and subscribe yourself for the NEET PG coaching program on the Incus app. Primary sinusoidal dilation of the liver is called pileosis hepatis. So typically this is the liver in the syphilitic cirrhosis. Nodular lobulated appearance, this is called hepar-lobatum. Large blood cysts scattered throughout the pulmonary parenchyma because the dilatation of sinusoids is called pileosis hepatica, is what you need to remember. So, pileosis, there are many underlying causes. One of the things is in HIV also, there is a pileosis. Bacillary angiomatosis, there is pileosis. Steroids, metals, TB, endocarditis, myelofibrosis, polycythemia, lymphoma, anything can lead to pileosis. Physical quality of life index. Literacy, infant mortality, and life expectancy at age 1 is the part of the P, Q, L, I is what you have to remember. What is the tidal volume in a patient ventilated for ARDS? It is 6 ml per kg. In order to minimize further lung injury. A lot of you are managing the cases with respiratory depression, dyspnea in the patients who are having COVID. So you should know what tidal volume beyond which it can lead to the development of the injury of the lung. A tidal volume of 8 to 10 ml per kg is usually appropriate. Persistent priapism can be a feature of sickle cell disease. Then, if you look at the most common cause of the priapism in adult population, painful erection, persistent erection. It is all those drugs that are used to treat erectile dysfunction lead to the development of the priapism as a adverse effect. Whereas in the case of the children, the most common cause of priapism will be sickle cell disease is what you need to remember. So, low flow priapism, if you look, dialysis, vasculitis, Fabry disease, TPN, anything can lead to the development of a low flow priapism is what I want to underscore to all of you. Now, how do you make the diagnosis of the polyps? It is the double contrast barium enema enables you to diagnose the colonic polyps. So this is how a double contrast enema. Here you can see a largest stalked polyp in the cecal. Histologically, this was a hematomatous polyp. This is a double contrast enema, which is showing a solitary polyp with a malignant change. Student's elbow is olecranon bursitis. The common peroneal nerve, typically it is the fibular neck, where common peroneal nerve can get injured. Now, glycoprotein 2B3 receptor blockade, where do you see? Apixaban is the one which typically inhibits, blocks the platelet glycoprotein 2B3 receptor is what you need to remember. A 22-year-old software engineer, shock, DIC, multi-system failure, and that there is a growth of the gram-negative diplococci on the Thayer-Martin's medium. That is Waterhouse-Friderichsen syndrome, which is acute gonococcal perihepatitis is what you need to basically remember. So this is the chocolate medium overgrowth, and this is Thayer-Martin, Neisseria only Neisseria. Whereas in the chocolate medium, there is an overgrowth of all organisms. Once you go to a specific selective medium, then only the Neisseria will be able to grow. Now, right axis deviation, left axis deviation, one of the favorite topics of the examiner. Guys, don't forget, on the same YouTube channel, tomorrow evening 6 p.m. you have a ECG class by one of the NEET PG Topper who is doing currently he is in MS General Surgery, but he is very passionate teacher. So every day 6 p.m. to 9 p.m. you have live sessions delivered by NEET PG toppers of the most recent NEET PG exam who are doing their first year MD, second year MD. They are going to come and deliver. Please don't miss. These guys know the secret of cracking exam. National faculty are all gone are those days where competition is not this much when those guys prepared for the NEET PG exam. So what is the fun with them? The real fun is if your mentor is very young, only 1 or 2 years senior to you in the post-graduation, recently cracked NEET PG. So we reached out to the top 5,000 rankers and 500 rankers came forward. 500 among the top 5,000 ranks came forward who are passionate to teach, said, why not? We will come on the YouTube channel and every day we will deliver live session. And we are also available 24/7 on the Incus app in order to mentor the NEET PG aspirants. So that is the reason, Doctor. Please tell your friends also to download the Incus app, so that you get all these recent NEET PG toppers available as mentors for you, 24/7 available. Now, Doctor. Right axis deviation occurs whenever the right ventricle hypertrophies, left axis deviation when the left ventricle hypertrophies. So that is the reason the right bundle branch, right ventricular hypertrophy, end of deep inspiration, they all lead to the development of the right axis deviation. Right axis deviation can also be a normal variation. So how will you identify right axis deviation? The lead 1, it will be looking down, lead 3 will be looking up, the QRS complex. They are right towards each other. If the QRS is looking up in lead 1, whereas in the lead 3, if the QRS looks down, then you call left axis deviation. That is, they both left each other. That's an easy way to remember. If the QRS is looking down in lead 1, in lead 3, if it is looking up, you see, here it is looking up, then they are right towards each other. When the QRS is looking up in the lead 1 and down in the lead 3, they left each other. Left axis deviation is what you have to easily remember. Now, Doctor, nematodes that infect you by ingesting infective eggs, what are they? Trichuris enterobius ascariasis. The infective eggs of the ascaris from the soil contaminated with human feces. Similarly, Trichuris trichura, whipworm, ingestion of the infective eggs. The pinworm enterobius, here the eggs are deposited on the perianal folds. Whereas Strongyloides turcuralis, if you take, it is not by ingestion. Declaration of the Oslo deals with abortion. 25-year-old male, progressive loss of vision, 10 years duration, crisscross, bifurcating, punctate opacities. That is an important clue. It is the lattice dystrophy is what I want to underscore to all of you. Lattice corneal dystrophy, amyloid degeneration, they are all the various causes of the primary corneal amyloid deposition. Now, in pregnancy, what is contraindicated, doctor? ACE inhibitors are contraindicated. Diabetes control and complication trial has shown that If chronic hyperglycemia is managed well, then microvascular complications of the type 1 diabetes can be prevented. So what is micro, what is macro, doctor? Coronary artery disease, peripheral arterial disease, stroke, these are all considered to be macro. There is diabetic nephropathy, neuropathy, retinopathy. If you don't manage, you will go to Tirupati. So, diabetic nephropathy, neuropathy, retinopathy, they are all called microvascular. So, mainly your good, tight glycemic control, according to DCCT trial, helps more of microvascular complication prevention than macrovascular, is what you need to remember. Vulvovaginitis, estrogen deficiency, forgotten foreign body, worm infestation, anything can lead to the development of vulvovaginitis is what I want to underscore. Keep punching the answers, doctor. Whatever that comes to your mind, you know, it is like combine the preparation. They will all meet and study together. So remember, every day evening 6 to 9 p.m. Don't forget. Put a notification bell. Subscribe to this YouTube channel. You have live class by the NEET PG Toppers. Every Sunday, 10 to 12 p.m., there is a grand test followed by discussion. All 52 Sundays. Don't forget, tell all your friends. So, doctor, vulvovaginitis, what are the causes in children you need to be very, very sure about? A 45-year-old postmenopausal lady, one of the short MCQ in the NEET PG exam, 8 centimeter lump adherent to the skin. Apical lymph node is formed in the axilla. One more node in ipsilateral supraclavicular area. No clinical evidence of distal metastasis. No clinical evidence of distal metastasis means M0. Ipsilateral supraclavicular area means N3. And based upon the size, it is T3, N3, M0 is what you need to remember. Any tumor more than 5 centimeters is called T3. Now, doc, this color coding, examiner, without that there is no question paper. Nitrous oxide is blue, helium brown, oxygen has a white shoulder. In MRI, how do paramagnetic substances look like? There's a shortening of both T1 and T2 relaxation times. T1 is the longitudinal relaxation time. If you look at the water, in the bulk phase, for example, in CSF, it has a long T1 relaxation time. So, if there is any T1 shortening, that means water is in hydration layers around the myelin protein rather than in the bulk phase. And if you look at the proteinaceous solutions like abscess, necrotic tumors, they have a higher percentage of water in the hydration layer and they have a shorter T1 compared to that of the pure aqueous solutions like CSF. I leave the literature for you. Paramagnetic substances shorten both the T1 and also the T2 is what I want to underscore to all of you. Briquet syndrome, it is characterized by multiple somatic symptoms. So basically, Briquet is a personality disorder where alcoholism and somatization disorder occur. Patient will say multiple physical symptoms, there is no physical evidence, and he keeps on seeking constant medical attention. Now, progressive pulmonary TB. primary, progressive primary pulmonary TB. You have a pulmonary nodule, lobar collapse, bronchopneumonia, but not cavitary. Cavitary is an indication of secondary, post-primary. That's what you need to appreciate. Can the online students can punch? Whether the voice is loud and clear and is the broadcast smooth, or is it getting stuck up due to internet? Can you please punch? Is the voice loud and clear for all of you? Now, doctor, in the primary immune deficiency, it is the gamma globulin fraction which become reduced. Vitamin K is required for 2, 7, 9, 10, protein C, protein S. Lorazepam has no active metabolite. Now, in Hashimoto's thyroiditis, it is a thyroperoxidase antibody. Rosette cataract is seen in ocular trauma. Post-exposure prophylaxis, we use stavudine, diadenosine, nelfinavir, zidovudine, lamivudine, etc., etc. Stress-induced ulcers are more common in the fundus of the stomach. Reversible airway obstruction, if it is more than 15% in FEV1 on spirometry, after inhaled short-acting beta-2 agonist therapy, that is the definition. Trichomonoid vaginitis, you use metronidazole to treat it, not doxycycline. Now, in case of pregnant women, how do you treat? We treat with clotrimazole in first trimester. After first trimester, you can give metronidazole. That is the treatment in pregnancy. The stomach motility is inhibited by the dopamine. Glycopyrrolate. It leads to tachycardia, excess salivation, suppression of gastric secretion. It is a muscarinic anticholinergic drug. It is a synthetic quaternary amine. That's the reason there is no central effect. With the glycopyrrolate is what you need to basically remember. Thank you, Dr. AK, for the good feedback. Good to see Faisal Gaur and many more who are all online. Now, what are the most common planets leading to airborne contact dermatitis? Parthenium hysterophorus, also called Congress grass. This is called nothing to do with Congress party, but Congress grass. Carved testes for ulnar nerve, as all of you know. How do you identify the electrical difference between across the membrane? We use the Nernst equation. Struma bovedii is a teratoma. Whenever there is starvation, the gallbladder will undergo dissemination, distension with the insippisated bile is what you need to remember. Because if you are fed, the gallbladder will contract and push the secretions into the GIT. Then it will empty. But if you are starved, then there is no cholecystokinin. That's the reason gallbladder is distended with insippisated bile is what you need to remember. Good to see Anita, Faisal, AK, Tina, and many more who are all online. Excellent, doctor. So once more, please don't forget, every day 6 p.m. to 9 p.m. we have live online classes happening on the YouTube channel. Every day, where NEET PG Toppers, national faculty, or myself, anyone will be delivering one or the other live online interactive session. Both, some of the sessions are based on the quick revision of the topics. Some are based on the MCQs, etc., etc. So, pre-recorded videos are boring, doctor. Live online interactive जो होता है, that is very interesting. You know, you can talk to teacher, you can ask the teacher, everything you can do, right? So don't forget to subscribe to this channel and also click on the bell button. Be part of our WhatsApp study group. Please call 9000868356, our helpline number, to become part of our WhatsApp group, so that we will shout before starting the session, after starting the session, etc., etc. So, doctor, A by A plus B into 100. So, you have diseased people, they can be true positive or they can be false positive, but all positives are typically there in the all positives are basically A and B. So true positives by all positives will give you the positive predictive accuracy is what you need to remember. So sensitivity is A by A plus C, specificity D by B plus D. Positive predictive value is A by A plus B into 100. So these formulas are going to be 100% sure, doctor. No mercy by examiner. Right gastroepiploic artery is a branch of the gastroduodenal artery. Gastroduodenal artery arises from the common hepatic artery. And it splits into right gastroepiploic and superior pancreaticoduodenal. All these blood vessels, from there, whose branch are they, is a favorite question of the examiner. PCO2 80, plasma bicarb 33. So high carbon dioxide means it is respiratory acidosis. Whenever you are hypoventilating, you are unable to ventilate, all carbon dioxide accumulates in your body, and that leads to the development of respiratory acidosis. 160 milligrams of the dose was given intravenously. 80 milligrams was eliminated during first 120 minutes. How much will remain after 6 hours after the administration? So basically, it is a question of half-life. So 120 minutes means 2 hours is the half-life. 6 hours means 3 half-lives have passed. Then what will happen if 3 half-lives are over? When 3 half-lives are over, 160 become 80, 80 become 40, 40 become 20. First half-life, second half-life, third half-life. This is 2 hours, 2 hours and 2 hours. Totally 6 hours. Simple question. The site of endometriosis, ovaries followed by uterine ligaments followed by rectovaginal septum. Atypical lymphoid cells in the infectious mononuclear. Typically they are CD8 positive T lymphocytes. Disease control means the agent is permitted to persist at low levels. Reduce the incidence, focus on the primary and secondary prevention like early diagnosis and treatment, vaccination, etc., etc. Whereas elimination means you are completely removing the organism like polio, diphtheria, etc., etc. Eradication means पूरा दुनिया में कहीं भी नहीं मिलेगा आपको. The confirmatory test for the blood is Tickman's test. So you have to be very sure this is the hemoglobin plus chloride. You get the Tickman's crystals look like this. This is the Takayama crystals, hemoglobin plus NaOH plus glucose plus pyridine. Bhopal gas tragedy is a point source epidemic. Spontaneous bacterial peritonitis. What is the definition? Ascitic fluid neutrophil count is more than 250 is the part of the definition. Along with the positive bacterial culture that defines the spontaneous bacterial peritonitis. Now, what is the risk of the scar rupture in case of the classical cesarean? It is about 1.5 to 4% is the risk. So you should know classical cesarean has a greater risk. Whereas if you look at the low horizontal incision with a phenylstein, so low horizontal incision, the risk of uterine rupture is only 0.5 to 1% is what you need to remember. 35-year lady presented with dysphagia, nocturnal asthma, weight loss. So nocturnal asthma means it is due to gastroesophageal reflux. Typically is a case of achalasia cardia. Hypoammonic state in an infant. How do you treat? We give exchange transfusion, remove ammonia, IV infusion of sodium benzoate, phenyl acetate and arginine. You add a mixture of essential amino acids. So this is how, in this, you don't do this exchange transfusion to remove ammonia is not the method. You give 10% dextrose, essential amino acids, sodium benzoate and sodium phenyl acetate and arginine. They're all given in order to treat. So neonatal hyperammonemic coma, how do you manage? Protein intake should be stopped. Calories should be supplied by giving hypertonic glucose. Hemodialysis should be started in all the comatose neonates. IV benzoate, phenyl acetate, intravenous arginine, no indication for steroids. Severe widespread psoriasis. You give methotrexate, oral retinoid, cyclosporin, not oral glucocorticoids. So, psoralen with ultraviolet A, light retinoids. Methotrexate, particularly for arthritis. Cyclosporin, infliximab, etanercept, adalimumab, elifacept. They are all the various treatments for the advanced psoriasis. Some of you are going to choose to become dermatologists. Agoraphobia. Typically, panic symptoms, avoidance of being outside, avoidance of the situations it is difficult to obtain help. That's called agoraphobia. Now, caseous necrosis in TB due to delayed type hypersensitivity. Monoclonality of T cells. How do you know? All infections lead to polyclonality. All neoplasms are monoclonal. So it is the TCR gene rearrangement which will help you to be a marker to know the clonality. Operational efficiency is identified by ABR, annual blood examination rate. Polycystic kidney disease, hepatic cyst, mitral valve prolapse, cerebral aneurysms, subarachnoid hemorrhage, they are all associated with polycystic. Severe hypercalcemia commonly is due to malignancy or primary hyperparathyroidism. Neurotensinoma typically is associated with cyanosis. Neurotensin is a neurohormone. So excess of neurotensin will lead to diabetes, hypertension, vasodilation, cyanosis, edema. And it can also lead to development of the Vardhathey syndrome. Watery diarrhea, hypokalemia, hypochlorhydria, and acidosis syndrome can be caused by neurotensinoma is what you need to remember. Angiotensin 2, norepinephrine, carbon monoxide, they are all the classical renal vasoconstrictors. So where do you see satellite lesions, doctor? Typically in case of borderline tuberculoid leprosy, eczematoid rash, rhythmic rocking, microcephaly, hypertonia. What is your diagnosis? Phenylketonuria. Clozapine can lead to development of agranulocytosis. So what are the branches of the thyrocervical trunk? Superior thyroid artery, suprascapular artery, inferior thyroid artery. They're all the branches of the thyrocervical trunk. So be very sure, one of the favorite question. And thyrocervical trunk itself is a branch of subclavian artery from the first part of the subclavian artery. The local anesthetics, whenever they act, which nerve fibers are affected where the transmission comes from? It is the group C fibers. First in group C. So A alpha, they are motor with fast conduction, myelinated, not very sensitive to local anesthetic. In that the type 1A and 1B are for proprioception. And I leave the literature for you. The C fibers, they are the postganglionic sympathetic fibers, very sensitive to local anesthetics. They don't have myelination. That is what you need to remember. Both intranuclear, intracytoplasmic inclusion bodies produce it in case of the measles is what you need to remember. Now, in the oral cavity, erythroplasia is very much implicated as pre-malignant. And what is median rhomboid glossitis? So this is the median rhomboid glossitis. And Candida has been suggested to be etiological factor. Fluorides in drinking water, 0.5 milligram per liter. Choledochotomy, where is it indicated, doctor? All indications you should know. CBD, common bile duct dilatation more than 8 mm. Multiple large stones, previous Billrod type 2, previous failed ERCP. And impacted stones with features of cholangitis. They're all the indications for doing choledochotomy. The best way to prevent hypotension during spinal anesthesia, if you give crystalloids before only, if you preload the patient, then you can prevent hypotension, is what you need to remember. After a single depressive episode, there is about 50% chance of recurrence of depression. A 15-year-old slipped capital femoral epiphysis. Slipped capital femoral epiphysis, one of the very hot, sure, short topic for the NEET PG exam, doctor. What you are seeing is a chondrolysis. If you don't treat the supracondylar fracture, progressively it leads to deformity, pain, decreased range of motion, etc., and ultimately chondrolysis, osteoarthritis, leg length inequality, etc. Ubiquitin, intracellular proteolysis, you have ubiquitin. It is a highly conserved regulatory protein present in all organisms like Paramdev, Mahadev, Shankar, हर एक जगह रहता है. So not only Shankar Bhagavan, even ubiquitin is also there in most of the organisms. And ubiquitin is associated with apoptosis, antigen processing, cell cycle and division, etc. Niacin, you should avoid it in patients who have peptic ulcer. So where do we use niacin? Niacin improves rigidity, bradykinesia in case of the Parkinson's disease. Microfilaria are present in Brugia malayi, Loba loba, Bucararia, Bancroftii, etc., etc. So this is the loba microfilaria in the thin blood smear using gene sustain. Malignant otitis externa. It is that external ear infection spreading along the bone and soft tissue. Human anatomical base. Which bag you want to put? Baba black sheep. How many colored bags you have? Yellow bag. So you should be very sure. Animal waste, different categories. Many times we discuss this. So in the yellow bag, you will put human anatomical, animal waste, discarded medicine, cytotoxic drugs, and solid waste. They all go, this is one table that should go and sit in your mind. Red bag में category 367, microbiological waste, soil waste, solid waste, etc. Now, linear deposits of immunoglobulin, good pasture syndrome. Maternal death means within 42 days of termination of pregnancy. You should not use mannitol if serum osmolality is more than 320, because mannitol itself is hyperosmolar substance. Pediatric Staphylococcus aureus infection. Meticulous hand washing before and after contacting the patients. Now there is a midline lesion which is lytic and expansile. What is your diagnosis, doctor? Chordoma. In sickle cell anemia क्या होता है? Valine replaces the glutamate. Glabella. It is a metopic suture remnant. It is glabella. It is the transketolase, erythrocyte transketolase levels which indicate thymine deficiency. Enalapril has no role in hypertensive emergency, whereas sodium nitroprusside, nitroglycerin, labetalol, they all do have a role. Nephrotic syndrome in adults is because of membranous glomerulonephritis. Carditis, you find caudate tendon effusion, valve leaflet thickening, McCollum plate, etc. And if you look at the valvular involvement, it is not bulk vegetations. It is the fibrin and platelet containing vegetations called verrucae along the lines of closure of the valve leaflets. That is what you come across. Now, corneal endothelium. How do you visualize that? Retroillumination is a technique by which you can be able to identify the corneal endothelium. So, if you want to know the corneal edema, you want to calculate the thickness of the cornea, pachymetry is a good way. Whenever you are planning, what is the first step in the planning cycle for health? First, you should do analysis of health situation. Similarly, when you are starting NEET PG preparation, first thing is, what are the topics first of all? What are the 953 topics? If you don't have these high-yield topics, please go to onlinembbs.com. There you have a PDF to download on the onlinembbs.com. There you can please download the PDF. Now, doctor, Infectious-scapulohumeral dystrophy, deltoid is spared. That's the reason deltoid will be prominent. That's called Popeye appearance. The cartoon figure Popeye-like appearance. Facio-scapulohumeral dystrophy. With regard to methyl alcohol poisoning, there is a high anion gap. It can lead to ocular toxicity. There is a high osmolar gap, etc., etc. About the methyl alcohol toxicity. So what is this most popular incision for open general thoracic surgical procedures? It is lateral thoracotomy is the popular incision. Fluctuating jaundice in middle-aged or elderly man, unless proven otherwise, think of periampullary carcinoma. Fluctuating jaundice. Dermatitis herpetiformis. There is a vesico-bullous disease in dermatitis herpetiformis. What lead to viral gastroenteritis, doctor? Adenovirus, calcivirus, enterovirus, anything can be responsible. So this session looks very fast discussion, but I want all of you to answer the questions before joining the session. Bilateral femoral fractures and shock. So what is the initial treatment? A, B, C. A for airway, B for breathing, C for circulation. You should not forget. Renal failure में जब kidney fail होगा, which anti-tubercular drug require dose modification? Ethambutol is what you need to remember. So you should know everything, anything about these anti-tubercular drugs, doctor. Plasma cells, lymphocytes, eosinophils, Russell bodies. What does it make you to remember? Rhinoscleroma. Socialized medicine is when you provide health services to all as a constitutional right. You can go to court of law if you don't get oxygen cylinder. Can you do that in this country? No. 20-year-old male, fever, fatigue, partial cervical lymphadenopathy, palatal petechiae, and splenomegaly. Heterophile antibodies. It is the infectious mononucleosis. So in metal diabetes, what is the characteristic fetal anomaly? Sacral agenesis is most characteristic fetal anomaly. Poor growth, poor appetite, recurrent chest infections, steatoria. It is the high sodium and chloride level in sweat. We are talking about cystic fibrosis. Extraluminal abdominal calcification in a newborn. Think of meconium peritonitis. So, intra-abdominal calcifications can be extraluminal or intraluminal. Accordingly, you should know what is the list of the causes. Panic disorders, recurrent, unpredictable panic attacks. So you should know the DSM-4 diagnostic criteria for the panic. No muscle attachments, that is the feature of TALUS. Quick dark adaptation occurs if you wear red goggles. CD16, CD56, and also important for immunological surveillance and natural defense against the virus infected cells, and for tumor surveillance. What is the type of cell you require, doctor? CD16 and CD56 is what I want to underscore to our view. Now, which is called liquid gold. Cannabis is called liquid gold. So how much do you provide in midday meal, doctor? Half of the protein, 1/3 of the calories which are required per day is what you need to provide in the midday meal program. So this organization called CRY, whenever you have money, you can donate 1100 rupees, which will be able to provide 1 full year of midday meal to the school children in the government schools. The most common site for the acute aortic dissection, it is the right lateral wall of the ascending aorta is the most common site. Wide split S1. So normally mitral valve closes first and tricuspid next. If the tricuspid become very much delayed, wide split S1 will occur. That happens in the right bundle branch block. Tamoxifen typically has a proliferative, it is anti-estrogen everywhere, but pro-estrogen on endometrium, and that lead to carcinoma endometrium on chronic treatment with tamoxifen is what you need to remember. Meniscal calcification, where do you see, doctor? Chondrocalcinosis. Extraocular muscle, inferior oblique, levator palpebrae superioris, inferior rectus. What is levator palpebrae superioris? Supplied by oculomotor nerve. Levator palpebrae superioris. Now, microbial cell wall synthesis. Vancomycin, meropenem, bacitracin, they're all inhibitors of microbial cell wall synthesis inhibitors. So which microscope enable you to identify the chemical constituents of the cells? It is the interference microscope. Macrophages with pass-positive granules, rod-shaped bacilli. Where do you find? In the case of the Whipple's disease. Oil droplet reflex, if you do ophthalmoscopy, where do you see? In the case of the keratoconus. What is the minimum recommended concentration of free chlorine, doctor, after 1 hour? 0.5 milligram per liter is what you need to remember. In beta thalassemia trait, you have microcytic hypochromic anemia, the same thing that you see even in iron deficiency anemia. Where is the ventricular septal defect most commonly located? Typically, it is perimembranous in location, is most common type of VSD. Typically, it lies in the LV outflow tract just below the aortic valve, just below the aortic valve. E-cadherin, where do you see the mutation? Diffuse type of gastric cancer. Most active among the plasma lipids, क्या होता है? Most active. Obviously, phospholipids are there in every cell membrane. Benedict's test will be positive in case of any reducing substance like ascorbic acid or glucose, anything can lead to. Hepatitis B virus is there in milk, sweat, lymph, not in stools. Sjogren's syndrome, keratoconjunctivitis, Zika, aqueous tear deficiency, KFD transmitted by ticks, tick-borne, viral hemorrhagic fever, acute myeloid leukemia, most common type is hypergranular promyelocytic leukemia. माला N में कितना होता है? Norgestal 0.3 mg, ethinyl estradiol 30 micrograms. That is what you need to remember. माला N, माला D. माला D में होता है Norgestal 0.3, ethinyl estradiol इसमें भी 0.03 milligrams. So what is the ideal replacement of esophagus? After esophagectomy, the ideal tissue is stomach only. Pulmonary hydatidosis, you get the drooping lily sign, meniscus sign, water lily sign, etc., etc. So this is the classic water lily sign of hydatid. Then you can see a crescent shaped air in case of the hydatid, and you can also see on the CT scan crescent sign, the meniscus sign. Conjugated hyperbilirubinemia in a neonate should make you think of Roter syndrome. Dubin-Johnson, Roter, conjugated. Gilbert, unconjugated. That is what you need to remember. Adam PS13 enzyme It is implicated in von Willebrand disease. Adam TS13. It is a disintegrin metalloproteinase. Von Willebrand factor cleaving proteinase is what you need to remember. Grave wax in forensic medicine means saponification. Now, hypertrophic cardiomyopathy. Don't give digitalis, don't give diuretics, don't give nitrates. You can give beta blockers, which decrease the heart rate, increase the diastolic time, increase the filling, decrease the touching between hypertrophied septum and the anterior mitral valve leaflet. If you distend the ventricle valve, that's a point you need to appreciate. Third stage of the normal labor, Brand Andrews controlled cord traction is the best way to do that. So, doctor, with that we come to the end of today's journey. Every Sunday, all 52 Sundays, you have a full-scale grant test. Along with that, last 60 days, every day we will have a full-scale grant test and discussion. And every day evening, 6 to 9 p.m., we are going to have a lot of NEET PG toppers, national faculty, live delivering the session in order to supplement the video library, which is there on the Incus app. So with that, let's hope to become better every day in our NEET PG preparation. Good night.